Joshi has more on the concerns about cancer referrals.
Until they actually said the word cancer, I was just like total shock, just bursting into tears, and I thought my world was collapsing around me.
In the space of a few minutes, William McGuckin's world came crashing down. William was diagnosed with MDS, a type of blood cancer, just 2 weeks before lockdown. Since then, his treatment and his life has been put on hold.
So anxious, and if COVID wasn't around, maybe my treatment would have started, and I would have been halfway through, maybe coming to the end of the first cycle. But I'm just eager to get on with it. They could treat me, but they said his actual words were, I wouldn't admit my own mother because it's too dangerous.
The peak of the pandemic has passed, but lives continue to be disrupted by the impact of COVID-19 on our health service. In April, the number of people being referred for cancer treatment dropped by 60% compared to last year. The number of patients admitted for routine treatments also dropped by 85%. And the number of people going to A&E decreased last month by almost 42% compared to last year.
It's going to take a very long time for the National Health Service to get back to any sort of new normal. It was struggling even before the pandemic. But one of the ways it can ease the pressure is by entering into more partnerships with the private health sector.
Optegra eye hospitals, like this one near Southampton, already take on NHS patients. But since the easing of lockdown, there has been a 40% surge in the number of NHS patients being referred here because of limited NHS capacity.
I'd like to step round here.
It means less anxiety and less uncertainty for patients like Myrtle, who has been struggling with a cataract for several months.
I could have done more if I hadn't been troubled by the limited vision. I was very relieved and so thankful to be able to have an appointment like this. Very, very grateful.
Surgery for conditions like vascular degeneration might not be as important as other treatments, but saving someone's sight is still a top priority.
There was some difficulties, obviously, as a result of measures to protect patients from coronavirus in seeing them in clinics and also performing elective surgery. As we emerge from lockdown, there is a plan to alleviate that, but obviously there will be a huge backlog.
Sky News understands that private health contracts awarded to cope with COVID-19 will be extended to clear the waiting list. That underlines the NHS message that treatment for the sick is and always will be available. Ashish Joshi, Sky News.
Now we want to pay tribute to some of